people who have a hard time controlling their rheumatoid arthritis with medications are at a higher risk of progression and need to be the most vigilant about tracking symptoms, Dr. Wallace says. That said, anyone with the condition should pay close attention to how they feel and talk with their physician about any changes in their symptoms or new health concerns, even if they seem unrelated to rheumatoid arthritis. Here are some signs to watch for that your rheumatoid arthritis may be progressing, despite treatment. For starters, pain is always a good indicator of rheumatoid arthritis progression, Dr. Chan says. It's especially telling if you start on medication and you get better, and then later on you start to develop pain again, Dr. Chan tells Self. However, some patients may have trouble noticing or admitting their pain has increased if it's still at a bearable level, Dr. Wallace says. After you've experienced a lot of rheumatoid arthritis pain and finally got it to a tolerable place with medication, small increases may be a blip on your radar. Furthermore, Dr. Wallace says some individuals don't want to acknowledge new pain if it's minimal because it saves them from going through the process of figuring out a new treatment strategy. Commonly, people will say their fingers don't straighten anymore or they can't bend or straighten them all the way, Dr. Wallace says. Their fingers don't necessarily hurt more, but they don't work like they used to work. Any range of motion or function changes like these can indicate rheumatoid arthritis progression, even without accompanying pain or tenderness. Be mindful of how you move and feel while doing various activities throughout the day, such as yoga, standing, or cooking. For example, are you suddenly making adjustments so that your hands feel comfortable while making dinner? Are you avoiding clothes with buttons because you can't button them? These subtle behavior changes can indicate rheumatoid arthritis progression, Dr. Chan says. You might think that these changes are not a big deal because you can easily adjust how you do things and feel fine, but you want to bring that to your doctor's attention. She says, it's easy to think of these changes as no big deal. But being mindful of your pain levels, mobility, and overall health can help you spot the signs of rheumatoid arthritis progression. Understandably, experimenting with new medications can feel stressful, but finding a treatment plan that helps you feel your best will allow you to move and live better in the long term. 5 ways to keep your quarantine workout routine going as you head back to work. Here from nurse who shared shocking weight loss photos. A look at the potential long-term effects of COVID-19. Wearing surgical mask may reduce COVID-19 infections up to 75%. Sneeze guards are trending right now. Here's where to buy one. Britney Spears' boyfriend, Sam Asghari, is here to keep us in shape. Oprah encourages young woman sharing her own weight loss journey. Try Bob Harper's at-home workout for a quick but effective routine. Testing the accuracy of coronavirus antibody tests. How one gym owner took her business online. Nurse reunites woman with dementia and her long-lost son. How Washington state kept coronavirus deaths under 1,000. Safety measures for COVID-19 could be harming survivors of domestic abuse. Woman gives birth to twins while diagnosed with COVID-19. Scientists hopeful for monoclonal antibody treatment. FDA shifts policy for antibody test makers.